Hello, everyone, and welcome to another episode of Arthritis at Home. Today, we're joined by Cheryl Koehn, President and Founder of Arthritis Consumer Experts, ACE, and we're going to talk about ACE's most recent national survey that is going into field in the first week of August. And Cheryl, welcome to this week's episode.
Thank you, Kelly. Nice to be here. Hi, everyone.
Now, our audience may have heard of some previous surveys, national surveys that we've conducted, and we started this program during the pandemic in the last couple of years. And they're designed, our ACE national surveys are designed to gather the views and opinions of people living with arthritis. And that's information that's going to help us lead our advocacy efforts on some of the most critical issues facing people in the arthritis community that they've identified and helped identify for us. So in the series of national surveys that we've conducted so far, we've looked at virtual care, we've looked at exercise in arthritis, self-advocacy, arthritis medication reimbursement, and our most recent one, mental health in arthritis. Cheryl, in that context, what is the next survey that ACE is conducting and what are we looking at?
So the survey that will be launched this week is really focusing on health inequities and the disparities that lead from that, their fallout from that in Canada. Health inequities definitely exist, and they are persistent. And in some cases, Kelly, I think we really look closely at healthcare, obviously, they're growing. And that's obviously not a good thing. For our arthritis community, I think if you've been tuning in regularly, you know that our focus on addressing health inequities specific to arthritis has been a focus, not just in our survey work and in our editorial content, but also in our advocacy work. So the work that we're doing to take the voices of our village, right? To take the voices of our community that are gathered through these surveys and turn around and share that information in an evidence-based way to government, which is where policy that would address health inequities would be generated and also implemented in the way of our healthcare systems. We've seen health inequities grow, as I mentioned, during the pandemic. In other words, the problems that people who face inequities, the things that they were dealing with prior to the pandemic, simply carried on through the pandemic and in some cases worsened. And I think that is can be seen clearly in one particularly important community, and that is our Indigenous brothers and sisters, our Indigenous communities across the land. So it's so important, Kelly, to do this work. We have a moral and ethical responsibility to do this work because it's not enough that the person who is privileged by the color of their skin or their economic or social circumstances can get to healthcare. We all in our arthritis community must be able to get the healthcare that we need and delivered to us in ways that are culturally sensitive and appropriate.
And just a reminder to our audience that our previous surveys are available for viewing on our website in a section called ACE National Surveys. And when they look at those individual surveys, which I listed earlier in the introduction, they can see that we broke down the analysis of findings. So we looked specifically at the responses from what are called BIPOC or Black people of color or Indigenous communities, people living in Canada, to look at how their responses differed from non-BIPOC. So they can find that information in all those different surveys. What we've done with this focused one is specifically look at health inequities, as you mentioned, Cheryl. When we speak of health inequities, just maybe to help out our viewers, what exactly do we mean?
Well, health inequities, as you pointed out in our previous surveys, we could see them in the results. So in other words, it's one group of people in comparison to another group or groups of people who have different racial characteristics, different cultural characteristics, and we see differences between them, Kelly. And we call those differences inequities. It's that simple, really. And they're often related to what is known as social determinants of health. And so there are social and economic disadvantages, and those social and economic disadvantages result in lower health outcomes or disadvantages or inequities, whatever kind of label you want to put on it. Inequities in health outcomes or in access to care can also be systemic, where, you know, these disparities are observable, as I mentioned before, across different populations of people. So our survey, this survey that we're speaking about today, is to increase our understanding and also then raise awareness about these inequities specific to arthritis care, and to service delivery, treatment, management, et cetera, et cetera. So you can't fix a problem unless you know the breadth and the depth of the problem. And I think from a crowdsourced data perspective, this work hasn't really been done or done enough in arthritis. So that's something that we can change, and it's our responsibility to take action.
For like what are people being asked to share in the survey?
Well, we're asking folks whether you believe you are facing a disparity or an inequity or not. We're asking everyone to take the survey, but obviously we're specifically interested in the responses of people who are going to answer who are facing inequities. We need to know at a deeper level why people think those are happening to them, so that we can better understand them and better articulate them through our writings and our advocacy work. So the survey really asked, Kelly, about details of inequities and discrimination that people living with arthritis have experienced or witnessed. You know, it could be a family member sitting in a clinic with a physician, and they observe the kinds of care or treatment or lack thereof for that person, not necessarily for themselves. And then the impact of those incidents and also how people care for themselves. It's not, you know, for people who face inequities, the burden to fix them should not rest on their shoulders. These are system issues. These are for people who are not facing those disparities, for those people to fix them. So it is to genuinely learn and then turn around and do the work that is required to, for lack of a better word, expose the discrimination, you know, expose the racism. We know racism is alive and well in healthcare, and it's not right. It's simply, it's a black and white issue. We as a society cannot allow that or continue to allow it to happen.
So I just want to follow up. I think this is really key for people to understand, is how ACE uses the information that it gains and gathers from the surveys. So you talk about, you know, how ACE can use it internally in their, you know, in our resources, programming, content creation. Maybe you can give an example of that, but then also I think people would be really interested to find out more about how we use it as you said, in our advocacy efforts, and maybe give an example of some previous surveys where maybe we've used findings as part of that outreach effort.
Yeah, so I think first and foremost, when people come to our surveys, they're anonymous and the information is gathered and analyzed in aggregate, right? So everyone's privacy is assured. The survey vehicle that we use is SurveyMonkey, which is very common, very popular, very safe. And we then take that information and we look at it in aggregate, Kelly. So all respondents pooled together, we look at those things, and then we say, well, the answer to question 10, how did people who are in the BIPOC community answer it? For example, did they ever feel uncomfortable? Let's say the question is, did they ever feel uncomfortable in an exchange with a physician when they went into the clinic to describe, the challenge that they're facing in terms of their health? Did they feel listened to? Did they feel heard? What action resulted from that complaint that they brought into the clinic? Did they, did they feel comfortable? Did they feel respected? You can ask these questions in a number of ways, Kelly, and the answers are illuminating. And we know from our past work, for example, you mentioned virtual care, that people from the BIPOC community did not have the same, they had less access to virtual care services during the pandemic. They didn't have the access to the technology, to the device, not even to the plain old offering of virtual care. So we saw those disparities or those inequities within that survey, and we've seen that as consistent across our survey program, that this experience for people coming from the BIPOC community is in some cases significantly different than the person who is a non-BIPOC community member. So it's through participation, Kelly. It's through the global village of people with arthritis in this country, on this land, that change arthritis, that changes the arthritis experience for everyone, because we can take these data in anonymous, safe ways and say to government, here is what the grassroots is saying. This is what the grassroots is experiencing, and they really value that, Kelly. Government does value it. It's not often easy to get through the door, but once we do, and they can see the data, and they can see the rigor with which it was developed or gathered, it does make change happen at the system level.
Which is why it's so important that people participate, if they want to get involved, to participate in a program like this. Because I think, just to underline what you said, Cheryl, that when we go in to see provincial health policy makers across the country, they are thinking about some of these big key issues. So they are thinking about virtual care. They are thinking about health inequities. They're thinking about medication reimbursement. What these surveys do is give us the real stories from real people from our community, and we share that perspective with them. So if they're looking at these big topics, they're looking at it through the arthritis lens now as well.
Yeah, absolutely, Kelly. And that you remind me to let our viewers know, the survey, it's easy to find. They just have to go onto our website. The link is there. It is voluntary, obviously. It is anonymous. You can stop the survey at any time if you decide to. And we do note where there are incomplete results on a particular question. Obviously, if you decide at any point you don't want to participate, your responses will not be used, so we can segment out partially complete surveys. It only takes about 15 minutes, Kelly, and we offer people, as a survey respondent myself, I always like when the organization asking the questions allows me an opportunity to write in my own experience. every human being has a different experience, even within groups of people, whether a culturally, identified group or racially identified group. Every human on the planet is different. And so we do offer people on a number of questions the opportunity for them to share their specific example, which of course doesn't include names or anything like that. We really encourage people to take the survey. It's so true that everyone's voice, when gathered in this kind of way, can change their life with arthritis. It really can. It can change the lives of people living with arthritis in groups as well. And it really does help government best do their job for our community.
So if you're an ACE member subscriber, you'll be getting a Joint Health Express that's going to describe this next survey coming up and how to get involved. As we said, if you also go to our ACE website, jointhealth.org, you'll be able to find a link to the survey and be able to participate through the website as well. So please.
And there'll be a link at the end of this video that takes them there.
Of course,
as well.
yeah. So it's summer. If you've got some time before you're going out to the beach or going out to play badminton in the backyard, take 15 minutes. We really, really value your participation and your input. And we look forward to getting the results and sharing them with you. We're aiming to do that in September during Arthritis Awareness Month. So you'll be able to look forward to those, seeing those findings at that time. So once again, thank you very much for joining us this week at Arthritis at Home. And Cheryl, thank you for describing to us ACE's work in national surveys, and particularly on this current one on health inequities. Thanks for your time.
Thank you, Kelly. I just want to say here as we wrap that ACE is learning too, that we are walking together with people of all communities and learning about the experience of inequity and trying to be the best ally we possibly can be to the communities who are not receiving the kind and quality of care that they should be. So all of that to say a huge thanks to all of our audience and to those who will go on to take the survey. We're very indebted to you for helping us walk the talk.
Thank you. See you again soon.